Yep. Okay, I'm inside the patient room with my supplies. I'm setting the supplies on the side. I'm doing my 20 seconds hand hygiene first. And in the meantime, I'm going to introduce myself to the patient. Hi, my name is Zhen. I'm the student nurse. Is it okay that I have you state your full name and date of birth for me, please? So you're Miss Liu Kim, and your date of birth is March 7, 1967. All right. Hi, Miss Kim. How are you doing today? How's your day going? Good, good. Are you having any pain or discomfort today? Oh, just a little discomfort on your abdomen area, a little distended. Okay, so yeah, that's what I'm here for. I'm gonna have the Foley catheter placed for you. That's the doctor ordered. So have you had it done before? Yes? Okay, that's good. So I'm gonna go through that procedure with you real quick. And before that, I'm gonna check your ID real quick. Is that okay? All right. So I scan your ID real quick, and then it matches my record, and date of birth is too. Do you have any allergy, Miss Kim, to the alcohol or iodine or anything? No. Okay. So basically, so what we're doing today is to have the catheter insert through your urethra opening to your bladder, and then have the balloon at the top of the tubing, and to inflate it and make it stay in your bladder, and then so your urine will come out, and then we're gonna have the tubing stabilized on your thigh, and then basically this procedure is painless, but if you do feel any discomfort or any unusual feeling, it's hard to tolerate, then let me know right away, okay? So I'm gonna have you in the supine position for me, and I'm gonna close the curtain for our privacy, and then give me a little time so I can set up the supply for us. Okay? All right. Thank you. All right. I'm gonna clean my hands for 20 seconds. Put on my gloves. Use the CHG wipes. Clean the table for full 30 seconds. Make sure to cover all the area. "25, 26, 27, 28, 29, 30, and the edges. And I'm gonna have the table dry for full 2 minutes. Remove my gloves, clean my hands, and put on my new gloves. Alright, Miss Kim, I'm gonna have these cardio wipes to clean your private area. Is it okay that I uncover you for now? Okay, thank you. I'm gonna lower your sheet, and I'm gonna pull up your gun, okay? Thank you. And have your legs put on the froggy position for me, like that, and hold it for me, please, during the procedure. Thank you. And the wipe's gonna be a little cold, okay? Bear with me, thank you. I'll use one wipe to clean the side, front to back. Second wipe, front to back, side, the other side. And third wipe for the middle part, front to back. All right, feeling all right, Miss Kim? Thank you. All right, and now the table is dry. I'll clean my hands for 20 seconds. Put on another pair of gloves. You feeling all right, Miss Kim? Not too cold? Okay, let me know if you're feeling cold, okay? You okay? Okay, thank you. I'm gonna set my supplies on the table. Okay. Have my kit out. Remove the packaging. Okay, open the packaging. And make sure I don't touch and contaminate the inside of the area. And I'll get the drape using non-touch technique. And put the drape in between the legs, shiny side down. I won't need this part, and I'll toss that. And then I will be opening my syringe and drop it in my sterile field. Also my stabilizer and the skin protectant, drop it, make sure it doesn't touch the side of the area, and my alcohol wipes. And then I'll open my sterile gloves. And have it drop on the table. And now I will remove my gloves, clean my hands. I'm ready to put on my sterile gloves. Everything okay, Miss Kim, over there? Okay. Make sure I don't touch the inside of the sterile glove. Insert. Fix the cuff. No. Set this on the side. First, I want to open my alcohol swabs. Actually, sorry, my iodine swabs. And set it on the side. And I want to attach my saline syringe to my port. And I also want to remove my specimen and place it on the side. Also, I want to remove the sheath of the catheter. And have it inserted in the loop and set it on the side. Now I'm ready to insert the catheter. I'll place this kit on the drape. All right. Miss Kim, I will use the iodine swab to clean your perineal area a little bit. It will be a little cold, okay? So I will hold the labia and have you retract. Use the iodine swipe. Clean the side front to back, drop. The other side front to back, drop. And the middle part front to back, drop. Okay, and then I will hold. I'll wait for 5 seconds for it to dry. And then I'll hold back 2 inches away from the tip. And Miss Kim, I'll have you take a deep breath for me, okay? And then 3, 2, 1, breathe in, okay? And breathe out, okay? For me, okay? Yep, breathe out, breathe out, breathe out, breathe out. Okay, now I see some urine coming out. Okay, I'm gonna go into another 2 inches. Okay, And I'm gonna let go this hand. I'll inflate the balloon. And then have the syringe removed on top. And then I'll pull, gently pull until I met some resistance. All right. And I'll make sure it's stabilized. Okay. And then I will use my clean hand to take the alcohol swab to swap the hub for 15 seconds. For 15 seconds. All right. Then I'll let it dry for 15 seconds. I'll use the syringe to collect 10 cc of urine sample. And I'll put it here. So I will collect it later. All right. And then I'm gonna use this skin protectant, and then on your thigh. And I will click this and open this, and then take this on your side to make sure it stays on the place, and then click this on the side of the bed. Make sure there's no kink, and make sure the urine will go smooth. There's no obstacle. Everything will be okay. All right. Everything feels fine, Miss Kim. Okay, let me collect. Okay. Let me hand this on the side of the bed. All right. All right, go. And then I will all right, and then I'll cover you up, Miss Kim. So I have the kit removed. Okay. 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 And then I'll remove the sterile gloves, perform my hand hygiene. I'll put on the pair of clean gloves. I'll open the specimen container and inject the urine in the container. Make sure it doesn't touch the container. And then cover it up and write down the patient's name, MRN number, date of time of the collection, and then tape it. And I'm gonna dispose have the urine sample sent to the designated area and collect for the and then I will remove my dirty gloves, clean my hands. I would do my documentation. I would document data time and patient tolerance, the procedure pretty well, and I will also document the 16 French size catheter was used, and then about 300 ml cc of urine was collected, and then patient was having a sent. And before I leave the rooms, I'm gonna make sure the room was free of clouders. And then Ms. Kim, do you have any question before I leave? And do you have any questions or any needs? You're okay? Okay, so I'm gonna have your bed to the lowest position. I'm gonna pull up your your side rails, and here's your call out. If you do need anything, let me know right away, okay? All right, I'll see you next time. All right, thank you. All right. Now inside the patient's room with my supplies. First, I want to clean my hands for 20 seconds. Hi, good morning. My name is Zhen. I'm the student nurse. Is it okay that I have you state your first name and full last name and date of birth for me, please? So you are Miss Liu Kim, and date of birth March 7, 1960. Okay, thank you. Is it okay that I take a look at your wristband also? Okay, give me a couple seconds so I can clean my hands. Real good. All right. All right, that's 20 seconds. All right, let me go ahead and scan the wristband. Yes, it matches the records. All right, Miss Kim, do you have any allergies that I need to be aware of, like to the tape, iodine, or alcohol, or anything? No, good. So how's your day going so far? Do you have any pain or discomfort? No, feeling good? Yes, that's good. And I have a good news for you. The doctor told me that it's okay for you to remove the catheters. So no more tubing, no more catheters, okay? So have you had this done before? Have you had this removed before? No? Okay, first time? Okay, so basically we're gonna deflate the balloon that's in your bladder. So it will have the tube be easy to remove, and then we're gonna it might feel a little tingling or burning, which is totally normal, but if you do experience any pain, so you let me know right away, okay? So let's start from there, and I'm gonna have you lie supine, which is lie flat, and I'm gonna close the curtain so we have some privacy, and then I'm gonna go clean my hands, put on my gloves. So everything up so far, Miss Kim, today? Yeah. Do you have any questions before we start everything? No? Good. All right. I'm gonna go ahead and uncover you, okay? All right, thank you. So I'm gonna lower the sheet, and then I'm gonna uncover your gum. How are you feeling? Are you cold? Do you need a blanket? No? All right, okay. I'm gonna need you to spread your leg a little bit for me, and then keep it like a froggy position the whole time, so I can, okay, that's better, okay. I'm gonna take a look real quick. I don't see any abnormal, which is good. And then I'm gonna go get my chucks, put it in between. All right. Okay. I'm gonna toss my gloves, clean my hands, get another pair of gloves, put them on. My wax here. I'll open my syringe, have it drop it on the chucks. All right, and first I wanna unclip the catheter tubings, and then from the stabilizer, and then have the syringe attached. And then I wanna hold on to the catheter, and then put out as much as saline that I can, and then have it squirt into the garbage. And I'll try to pull it out to see if there's any resistance. If I do see any resistance, I'll try to move out more until all the saline is gone. Yes. And now everything is gone. I will, okay, Miss Kim, I will have you take a deep breath, and then, all right, 1, 2, 3. Okay, breathe in and blow out. All right, thank you so much. All right, I'll have this, wrap it up. Okay, everything okay? All right, I'm gonna cover you up for now. I'll bring the bag and everything to the bathroom. I'll be back in a second, real quick, okay? I'll go to the bathroom and then pull this into the cylinder, and then measure how much the urine, and then observe the urine, the color, and the consistency, and see if any cloudiness, and then I will toss it in the garbage, and then I will remove my gloves for my hand hygiene, and I'll come back to my patients. Hey, Miss Ken, I'm done with your urine assessment. Now let me get your legs in the position. So I'm gonna get the alcohol wipes, have it open. And then I'll use another pair of gloves. Clean my hands first. I use alcohol to wipe off the glue or the stabilizer, so it will be easy coming off. All right, and then toss it. All right, Miss Kent. Now everything looks good. Are you feeling all right? Good. Okay. Okay, I'm gonna have your leg straight, back to straight, and then cover you up with this blanket. Have your gun back. All right. Are you feeling okay? All right. Any questions? Any discomfort? No? Okay. All right. I'm gonna lower your bed to the lowest position, and then I'm gonna have your side rails up, and then here's your call light. Okay. So before I go, I'm gonna let you know the next two voids, you might experience a little tingling and a little burning sensation, which is totally normal. So you let me know so I can come measure and take a look at your urine, and so make sure everything is okay. And if it does look there's blood inside, and if you do have problem urinate, or there's severe pain when you try to urinate, you let me know right away, okay? All right? So, and any other questions before I go? No? Okay. And then I'm gonna remove my gloves. So you let me know if you need anything, okay? Have your call light. All right. Everything looks okay. I cleaned the cluster and document everything. The patient tolerant everything well. And I wanna clean my hands and document the patient tolerant the procedure well. And then the patient has 300 cc urine and clear, and no cloudiness and no foul smell, and then patient tolerant the next two voiding without any pain or complaint, and then I'll do the daytime and then initial, and that's it. Okay.